Suicide is a tough word for some of us to hear. Talking about it can be even harder.
This is National Suicide Prevention Week. Our Sam Rogers shares advice from mental health professionals on how to have those difficult conversations, how to get help, and reminds us we're never alone.
Unfortunately, it has affected my family before, and I've just known a lot of people that have struggled mentally.
This is Nicholas Merrill. His high school guidance counselor took his own life.
And nobody was really talking about it. Everybody for their senior projects was doing like cancer walks or other, and I really just wanted to kind of bring light to the subject.
So he did, organizing a fundraising walk at 17 years old, then hosting a similar event as a freshman at UMaine.
Suicide for so long was such a taboo topic that wasn't allowed to be discussed almost. I mean, not that it wasn't allowed, but people didn't talk about it.
Talking about it.
It's okay not to be okay.
Is something mental health professionals like Crystal Eldridge and Tori Wilcox suggest we all do.
When we do talk about it, then we can know, we're not alone and there are people that care.
We don't have to give advice. We don't have to fix it. If they need 5 minutes to come up with the answer, or if they just want to not talk about it, as long as they know that you're there.
Both Eldridge and Wilcox work at Northern Light Acadia Hospital in Bangor, sharing the same message: be direct.
And ask some of those really tough questions.
Like asking if someone is thinking about suicide.
And if you ask that direct question, you're gonna get the direct answer. They might not always share the real answer, but at least you've opened up that conversation so that they know they can.
Wilcox adding there's a myth about prevention, that if we talk about suicide, it plants a seed.
And, actually the opposite is true.
And what we found through research is actually reaching out could stop somebody in that moment.
Merrill is now the programs manager for the local chapter of the American Foundation for Suicide Prevention, working with businesses and younger Maine students.
It's very approachable, the language is appropriate, and it really focuses on self-care, finding your trusted adult, and just mental health awareness in general.
According to NAMI Maine, the highest rates of suicide are among middle-aged men and young adults ages 15 to 24. So educating students and staff is a focus for the organization.
What is their role? How do they help a friend? And how do they connect with a responsible adult that they trust when they're concerned about themselves or somebody else?
It's all about ending the stigma.
Talking about it opens up that conversation so that people know that help is there.
And letting them know how to access that help, because we're never alone. As Marley says, it's up to all of us to look out for each other and make sure another family or another stranger never has to go through the pain of losing someone to suicide. Sam Rogers, News Center, Maine.
And those mental health professionals want to remind all of us about the resources that are available. The Maine Suicide and Crisis Line is available 24/7 by dialing 988, or you can use the original phone number of 1-888-568-1112. There's also the National Crisis Text Line. You can text the word TALK to 741-741. We will also have more information and advice on our website, along with a list of upcoming suicide prevention events around Maine that you can attend or get involved in.